Welcome to The Explainer. Today, we're unpacking one of the most complex, expensive, and honestly heavily scrutinized line items in state governance, the fiscal realities of Alabama's correctional healthcare budget. You know, Alabama's been under this intense, long-running pressure to improve prison conditions, expand medical and mental health services, and somehow manage the enormous costs of treating a really large incarcerated population. It's an incredibly delicate balancing act of budgets, logistics, and legal obligations.
When most of us think about the cost of incarceration, we immediately picture the visible stuff, right? The guards, the perimeter fences, the food, keeping the lights on. But what is the biggest hidden cost of incarceration? The reality is, the massive, unseen expenses lie way beyond basic security. People in custody still absolutely need medical care, and providing that care isn't just some logistical necessity, it is a strict legal requirement. All right, let's dive into our roadmap for today. First, we'll look at the hidden corrections cost. Second, why it costs so much. Third, state prisons versus county jails. And finally, the taxpayer's bottom line. Starting right off with Section 1, the hidden corrections cost. To really wrap our heads around this budget, we have to completely redefine what medical care actually looks like inside a prison facility.
Because it is far more expansive than just a first aid kit and a blood pressure cuff. This quote from the source material really hits the nail on the head. Quote, "It is not just a nurse's office, but a full medical system operating behind bars." Think about that for a second. The state's prison medical contract has to cover everything from basic diagnostic services all the way to hospitalization. They are essentially running a massive parallel healthcare network exclusively for the incarcerated population.
And the sheer scale of that parallel network is just staggering. For routine and emergency care, facilities have to handle thorough intake screenings, diagnostics, and immediate emergency treatments. Then you move down to specialized care, and the state is on the hook for pharmaceuticals, physician fees, and both inpatient and outpatient care. And this is absolutely crucial. Under mental health, they're responsible for emergency psychotropic medications and even full-on hospital-level psychiatric care. They literally have to plan for much more than basic first aid.
Which brings us to Section 2, why it costs so much.
I mean, if the state is running an entire medical system, what makes this particular system so incredibly expensive to operate? Well, it's a perfect storm of multiple pressure points. First, just consider the population itself. Many incarcerated people enter custody with severe, untreated chronic illnesses, substance use disorders, and serious mental health needs. That requires immediate, heavy intervention. Then you've got the logistics. Hospital transports and outside specialists require custody staff to actually travel with the patient, which completely drives up overtime costs. We also have to factor in staffing shortages. Recruiting doctors and nurses to work in, frankly, difficult-to-staff correctional locations often forces a reliance on much more expensive outside providers. And finally, just look at the older facilities themselves. Poor ventilation, outdated layouts, limited clinic space, all of this makes the actual delivery of care in older Alabama prisons incredibly inefficient and labor-intensive.
So, what does this all mean? How does the state actually manage this immense financial and logistical burden, especially facing all those compounding cost drivers?
Well, the answer lies in massive, incredibly complex vendor contracts. Healthcare in Alabama state prisons isn't fully run in-house. It's managed through contracted services. But this landscape is constantly shifting. For example, back in 2021, the legislature authorized a prison modernization plan to build new facilities, expand medical space, and hopefully cut down on those older facility inefficiencies. But managing the vendors themselves, that's an ongoing challenge. Look at May 2026. The Alabama Department of Corrections terminated its healthcare contract with YesCare and immediately had to jump into an emergency agreement with NAFCare just to avoid any interruption in services. It's a stark reminder that correctional healthcare is never static. Actually, scratch that. It's more like a constant scramble to maintain continuity of care.
And when the state negotiates these massive contracts, they evaluate the procurement on a very specific, fascinating metric: per inmate per month. This just goes to show how central and sensitive these variables are. Because the cost is calculated per inmate per month, even the most microscopic changes in hospitalization rates, or medication use, or specialist referrals across a huge population, they have a massive, immediate impact on the state budget.
All right, moving into Section 3, state prisons versus county jails.
Up until now, we've focused heavily on the state prison system. But to really grasp the full fiscal reality here, we have to look at the structural difference between state and county levels, which is literally night and day. State prisons use those comprehensive, long-term contracted vendors we just talked about, mainly because they're managing a relatively stable population serving long sentences. County jails, on the other hand, hold people awaiting trial, serving short sentences, or just waiting for transfer. Their population changes rapidly. This makes the healthcare costs for county jails highly unpredictable and incredibly difficult to budget for.
Just think about what happens when someone is arrested and brought into a county jail straight off the street. They might arrive in the middle of a mental health crisis requiring immediate stabilization, or maybe they have a severe, untreated physical injury. This creates a really harsh reality for local budgets. County jails often have to absorb these immediate, massive medical costs before the person is ever transferred or released. The counties are basically acting as the first responders of the correctional healthcare system.
And that leads us to our final section, Section 4, the taxpayer's bottom line.
We've looked at the medical needs, the structural inefficiencies, and the differing burdens of state and county systems. Now, let's connect all this directly back to you, the taxpayer. Sometimes people will point to internal fees as a way the system kind of pays for itself. Like, the Alabama Department of Corrections does have regulations that include a copay fee for inmates who miss scheduled medical appointments. But here's the crucial point. While those copays exist to discourage missed appointments, they absolutely do not eliminate the state's constitutional responsibility to provide care. At the end of the day, the primary financial burden inevitably falls on the state and, for sure, by extension, you.
And if the state tries to cut corners, it builds into a massive domino effect of consequences. Step 1, underfunding necessary healthcare. It might seem like a great way to save money in the short term, right? But that directly leads to Step 2, inadequate care and way worse health outcomes for the incarcerated population. And that just triggers Step 3, lawsuits, intense federal oversight, and massive emergency hospital bills. Ultimately, underfunding healthcare in a correctional setting ends up being just as expensive, if not way more so, than overpaying for it in the first place.
As Alabama continues to navigate facility modernization, those rapid contract changes, and the really complex medical needs of its incarcerated population, it leaves us with this final, vital question. For taxpayers and policymakers alike, the issue isn't simply whether healthcare is expensive. We already know it is. The real question is, are we spending money to prevent avoidable suffering, or are we just paying the higher, hidden price of inadequate care? Healthcare in custody is not optional, it's definitely not cheap, and it is going to continue shaping budgets and reform debates for years to come. Thank you so much for joining me for this explainer, and I hope this gave you a clearer view into the true costs operating behind bars.